Hello everyone and welcome to Healthline. I'm Lynn Vaughn. You know, Fulton County's Health and Wellness Department is one of the largest public health service providers in the state. And that's of course because we are the largest county in the state. Well, Healthline is a program that highlights some of the department's services and news. On this episode, we have the pleasure of talking to Dr. Patrice Harris, Director of Health and Wellness, about a major public health threat in our county, HIV and AIDS. Healthline begins right now. And again, welcome. We begin this edition of Healthline with a new initiative by the Board of Commissioners aimed at tackling HIV/AIDS. That disease is hitting the county and the entire nation hard. The latest statistics from the Centers for Disease Control and Prevention show Georgia is ranked in the top 10 states for its rate of new HIV/AIDS diagnoses. And Metro Atlanta is affected especially hard. Now, in the United States, more than 1.2 million people are living with HIV, and 1 in 7 are unaware of their infection. Joining me right now is Dr. Patrice Harris, Director of Health and Wellness, to talk about the efforts that the County Health Department is continuing to make to stop the transmission of HIV/AIDS and to create awareness of what this problem really is. Dr. Harris, tell us a little bit about the dimensions of the problem of HIV/AIDS in Fulton County.
Well, certainly you mentioned and you talked about Georgia being in the top 10. We're actually 6th in the country as a state regarding the prevalence of HIV and AIDS. And then if you look at Fulton and DeKalb counties, of the 18 health districts and of the 159 counties, Fulton and DeKalb have the highest incidence of HIV and AIDS. We have the highest incidence of persons living with HIV and AIDS. So it is a problem, and we are ready and willing and able to try to address it.
Are there particular groups of people within the population who have this problem more than others?
Well, certainly we know that the highest population with this are men who have sex with M, the MSN population, and so they have a high rate of new infection of HIV.
Mm-hmm. Now, what about the problem that we mentioned of people not knowing their status? Apparently people have it and don't know they have it, and I can imagine that that has consequences for transmission.
Absolutely, and we talk a lot about knowing your status, and I can imagine that for some folks they don't want to know, and I think that we have to talk about this in terms of where we are today. Mm-hmm. I think some people think that we are where we were when you first got diagnosed in the 80s, when it was a death sentence at that time. That is no longer the case. There are people who, when they get tested early and they know their status and they start treatment, they can live, and HIV becomes a chronic illness like diabetes rather than an illness where there is going to be a shortened lifespan.
Well, let's go back and talk about that, because that, I believe you are right on point, that is an opinion or an impression that people still have. The beginning of AIDS, there was such stigma, and do we still have to deal with that as a problem?
We absolutely still have to deal with the stigma, and I think it is because people don't know. Mm-hmm. We are embarking on a national campaign, Greater Than AIDS, and one of the messages we want to get across is there is hope. And so again, you talked about not knowing your status. When you know your status, you can then begin to get treatment if you need it. You can then protect yourself and your partners to ensure that it's not transmitted to other folks. So really, knowing your status is critical. And we want for people to talk about it and know about it, get accurate information, and know that a diagnosis today is quite different than, again, as you mentioned, the diagnosis in the 80s.
And understand that it is a disease like other diseases, that there is no special shame attached to a diagnosis of HIV/AIDS. I understand the BOC is establishing a task force to address the issue of HIV/AIDS. What are the goals of the task force?
Well, you are correct in that at a recent meeting, Chairman John Eves and Commissioner Joan Garner sponsored this resolution. And it's to really amplify the work that we are already doing, but really bring in more and more of our community partners, folks in the community who are working on this issue, so that we continue to collaborate and make sure we want to get to zero. We want to look out 20 years from now, and we don't want Georgia to be the 6th highest in the country, and we don't want Fulton County to have the highest rate of persons living with HIV and AIDS. We'd like to get to zero. So this task force will amplify the work that has been done, but will serve to come up with new ideas and new ways. You know, we often say the county cannot do this alone. And so we really do need our experts that are in the community, and we need our community partners to help us on this journey.
Well, tell us about some of the great work that we are doing in terms of treatment. When a person comes into one of our clinics and presents and discovers he or she has HIV/AIDS, what happens from that point on?
So from that point on, it's important to get some additional blood work, again, to know your T-cell count. T-cell count is our fancy way of those immune fighting cells, those cells that attack the virus. And then when those cells are low, people are more likely to actually have symptoms and become ill. So you'll get a series of blood tests, and then a decision will be made about medication. And so in our clinic, we have funds from the Ryan White program. Don't want to get too much into the weeds, but clients who are then eligible for Ryan White can get primary care treatment in our program. But there are many others in the community that are offering that treatment as well. I want to say something else about treatment. I think treatment in the traditional sense of the word is that you have a problem, I'm the physician, I'm going to do an intervention. But in the case of HIV and AIDS, we want to get the word out that treatment is prevention. And so when you know your status and you get treatment, you are really preventing other folks from getting HIV and AIDS.
Clearly, because it gets back to that point of transmission. If you don't know, then you're perhaps behaving in such a way that you are spreading the disease.
Absolutely.
So that, yeah, I like that part about the treatment and right on the spot, so that the person doesn't get the diagnosis and then go out into the community and have to worry about, oh, what do I do about this? I mean, we take care of it from the very beginning, and that's really important, I think.
And that's another exciting development. The community may be aware that for the past several years, we've been directly funded by the CDC for our HIV prevention program. And recently, the board approved our purchase of testing so that folks can know their results right then and there. I don't know if you remember, Lynn, but in the 80s, people had to wait sometimes weeks for the results of their treatment. Oftentimes, folks did not return.
Right.
And so they still didn't know.
And imagine the strain
The
and
strain,
the worry.
the anxiety.
Yes.
And so really with the testing that's available now, folks can get their results immediately. When they get their results immediately, again, they can be connected to other resources that they need. And I can't say it enough. Again, that enhances our prevention efforts because treatment is prevention. So we're very excited about that recent development.
And we're going to get the word out. Now, I know that we also test for other sexually transmitted diseases. Let's talk a little bit about what those are.
We do, because we know that folks with HIV are at also a high risk for other sexually transmitted diseases, syphilis, gonorrhea. And so we also test for those diseases at the same time. And there's sort of when you have those comorbid conditions, it really increases your risk of getting the other diseases. So it's important to test for all of those at the same time. And of course, if treatment is needed, we can offer that treatment.
And back to HIV/AIDS, one of the things that we do is go outside of our clinics to reach out to the community to help people get testing in case they're reluctant. Let's talk a little bit about our outreach efforts.
That is a critical piece. You know, sometimes as healthcare providers, we wait for people to come into the office. Really, we have to have a different paradigm, actually on this and many other diseases. We have to get out into the community. So our disease investigators, our health outreach workers, they go to where the folks are. They go to where the needs are. So certainly testing in clinical settings, those are office settings, hospital settings, are appropriate, but also we might have a testing event at a club. Or other non-traditional settings where we know folks, barbershops, where people are at high risk and may need the information. They may feel more comfortable getting tested in barbershops, in their community, rather than coming in for treatment. So that is a critical piece of the work that we're doing.
Well, I can't wait for us to begin with the task force and get the word out about all the wonderful things we're doing to help stem the tide of this disease.
It's an exciting time, and the more we amplify our efforts, I think the greater our results will be and the better outcomes we will have.
Well, Dr. Harris, thank you so much for being with us to discuss this very, very important topic. And we'll see you again on another subject in a short time.
Absolutely. Thank you for having me.
Coming up next on Healthline, we have some promising news about smoking rates and how you can kick the habit. We'll be right back. Welcome back. I am happy to report there's some good news about the health of young people in our area. The smoking rates for teenagers is going down. You hear about the problem, but often miss the story when initiatives actually work. Well, here's one. Awareness campaigns and tougher regulations are pushing youth smoking rates down.
Fulton County has been involved with a community-based grassroots coalition called Smoke Free Fulton County that does quite a bit of education in schools as well as in the media and other areas to try to educate children as well as adults about the dangers of smoking.
The Georgia Department of Public Health says youth who have used any form of tobacco dropped from 26% in 2003 to 19% in 2013. Adult rates have also dropped, but still more than 1.5 million Georgians smoke. Medical Director Dr. Matthew McKenna says getting that number down has been a top priority in the county.
We estimate about 700 deaths a year in Fulton County are attributable directly to the use of tobacco. And it affects every organ in the body when someone smokes, causes over 40 types of cancer.
Dr. McKenna says tougher federal tobacco regulations passed into law in 2009 are making a difference. Those regulations include bigger warning labels and requiring proof of age to purchase tobacco. Now, if you're still one of those people who's working to quit the habit, there are ways to make it easier. Blue Cross Blue Shield sponsors a number of health seminars for county workers. The latest sessions are focusing on quitting smoking.
Even if you stop smoking for a day, the things that it triggers, high blood pressure, maybe coughing and wheezing, those kinds of things can stop in a 24-hour period, be lessened with even one day of not smoking.
According to the Centers for Disease Control and Prevention, about 17.8% of American adults smoke cigarettes. It continues to drop from 1965 when more than half of American men and a third of women smoked.
What I recommend is that you substitute something for the smoking. Bubble gum, chewing gum, a lollipop. Believe it or not, smoking has a lot to do with actions, behavior, things that you do.
So if you or somebody you know needs help quitting smoking, we want you to go to smokefreecoalition.net. That's smokefreecoalition.net. Up next on Healthline, from counting calories to healthy and delicious snacks, we'll give you some tips for a well-rounded diet. Don't go away. We'll be right back. Welcome back to Healthline. I'm Lynn Vaughn. Making sure you eat the right amount of calories each day will soon be easier. By the end of the year, chain restaurants, grocery stores, and movie theaters in the U.S. will have to post how many calories are on each menu item. The director of Cooperative Extension says it's important for people to know their calorie needs and their calorie intake.
For a certain weight, you should have 1,200 calories. If you are a little bit over the 1,200 calorie mark, you should have 15, 18, and 2,000 respectively. It depends on what your doctor says, but fitting in those categories there.
The new FDA regulations will also apply to bakeries, coffee shops, and vending machines. Now, according to the CDC, in order to lose about 1 to 2 pounds per week, you'll need to reduce your calorie intake by 500 to 1,000 calories. And feel free to contact Cooperative Extension for information on nutrition classes that can help you reduce your calorie intake. That number is 404-332-2400. And there are simple changes you can make in your diet that will help you be healthier without cutting back on the flavor of foods. During an Eat to Live event at the Oak Hill Child, Adolescent, and Family Center, the Employee Wellness Committee showcased how to incorporate fruit smoothies into your well-balanced diet.
People have a lot of lose weight, be healthier resolutions, and that's why we wanted to start off with the smoothies as a simple, easy way just to add nutrition to your diet. So we don't want to take away people's foods that they love. We just want to show them different ways to add extra fruits and vegetables and different types of protein into their diet.
And the session also explained that eating organic popcorn is better than traditional popcorn because organic popcorn doesn't contain genetically modified corn. The sessions are part of the county's Healthy Workforce Initiative that puts an emphasis on employee health. So less money spent on healthcare costs for employees means more money spent on county services. And children at the Oak Hill Child, Adolescent, and Family Center are learning the basics of eating right, too. The new cooking class shows children and their families how to eat right while sticking to a budget. From measuring to chopping and stirring, the Cooking with Choices classes are giving families the hands-on experience of making healthy meals.
Just realizing, like, the kitchen, it can actually be fun. It doesn't always have to be boring.
Commissioner Joan Garner handed out completion certificates for those who attended the 6-week series. The children are part of the Clubhouse for Youth, where teens learn strategies to help keep them safe and away from drugs.
They've learned how to create and cook their own meals from scratch on their own, and they've been given the opportunity to learn healthier and easy ways to cook and also do them on their own and not just have to buy everything or depend on help from their parents.
It would cost about $10 to make these meals for a family of 4.
With that, we try to teach fresh ingredients and tasting the rainbow. So with our vegetables and fruit, we try to look for a colorful rainbow of red, yellow, green, white, and purple vegetables. So when we're making our dishes, we focus on the vegetables and teaching about different vegetables, teaching children and kids about different vegetables, trying new vegetables such as spinach or mushrooms or bell pepper for the first time.
The classes also suggest cheaper alternatives like using frozen vegetables or low-sodium canned items. The program will continue to grow this year at the Oak Hill Child, Adolescent, and Family Center through partnerships with groups like the Choices Organization. Good job. Up next on Healthline, grab your resistance bands and stay tuned. Our fitness expert has some tips to help you get started on an exercise routine. Back in a moment. Hi again, welcome to Healthline. Now, starting an exercise routine can be a daunting task for many of us, but Fulton County's fitness expert has some tips to help you get started with strength training.
Hi, I'm Robin Parson, your fitness specialist here at the Fulton County Employee Fitness Center. Today we're going to focus on strength training. Now, I'm going to use a resistance band. Now, many people would recommend free weights or the machines, but I always believe that your own body weight is the best when it comes to strength training. So today I'm going to use a simple tube. Now, these tubes are, again, you can get them in different sizes, different lengths, depending on what your strength level is, but this particular band is mainly for a beginner, intermediate, as well as an advanced. It depends on the range of motion that you use to really give you that extra push. So you're going to start with a simple, just step on. We're going to do some bicep curls, okay? So you want to make sure the band is right in the middle of the arch of your foot. You want to make sure your shoulders are relaxed because form plays a very important role. So roll your shoulders back, stick that chest out, relax your knees, and we're going to start with a simple curl, focusing on the biceps. Keeps the arms very close to your body. So you want to bring the arms up to your shoulders and back down. That's the move. Now, within that move, breathing again is very important. So when you bring it up, you want to inhale, and when you bring it down, you want to exhale. Okay? So remember that. Breathe. That's going to help you with your form. It's going to help you determine how many times you can actually really accomplish the sets. So let's start with the bicep curls again. Bring the arms up and down. Good. Up and down. Make sure your moves are very controlled. You do not have to go in a fast pace. Just keep it nice and controlled and slow. Good. Deep breath. In and out. Good. Good. Remember, breathe in on the exertion. Exhale. Good. When you're coming out, go. Breathe in and out. Good. And that's just for the bicep curls. I'm going to demonstrate another arm routine, strength training routine you can do for your rotator cuffs as well as your shoulders. So you're going to stand, again, on the band, making sure it's nice and secure under your foot. And you're going to bring your arms up shoulder levels and back down. Good. Remember, form is important. Bring the arms up to the shoulders and back down. Remember, breathe in and out. Good. Now, if you do this about 20 times, maybe 3 to 4 sets, you will definitely get a good workout, and you will definitely feel it in your arms. The focus is that you want to feel the muscles burning. You want to feel the muscles actually contracting and releasing. But at the same time, you want to make it slow and controlled. Good. And I'm going to demonstrate one more for you. Good. Okay, now we're going to try out to the side. Now this particular exercise, again, works the upper part of the body, but more so in the back area and the deltoids and all those good areas. Okay, ready? And start to the side. And whatever you do, don't fly up. Don't do that. You want to control it. So just stop it right there at the shoulders and down. Good. Right at the shoulders and down. Right at the shoulders and down. Awesome. Great. And when you find yourself becoming a little fatigued, you can always stop and roll the shoulders and shake it out and start over. Thank you for joining me today, and I'll see you next time.
Now we can do that. We hope you've enjoyed this edition of Healthline. I'm Lynn Vaughn. Remember, you can learn all about the services of the Health and Wellness Department by phone or online. Go to FultonCountyGA.gov and click on Department and Agencies and then the Health and Wellness link. Thanks for joining us. We'll see you next time.